Having a child is one of the most exciting times of a woman's life. However, it is also one of the most fragile. There are 3 trimesters during pregnancy, and your body will go through dramatic changes during each stage. It is important that you educate yourself about these changes so that they don't surprise you. Here are some helpful tips that will make each trimester easier for you and ensure a successful pregnancy. During weeks 4 to 28 of your pregnancy, you will need to visit your doctor at least once a month. This will give you the chance to follow the growth of your baby and ask any questions you may have. If you are a cat owner, you will need to skip changing your cat's litter. Cat stool is known to cause complications within pregnant women. If you don't have any choice, make sure that you wear gloves and give your hands a good wash afterwards. Cheese made from unpasteurized or raw milk may contain organisms that can damage your baby. Vitamin B6 and ginger will help with vomiting and nausea. Before you start taking them, make sure you get approval from your doctor. Before taking any supplements, herbs, or over-the-counter medications, check with your doctor beforehand. Pay attention to your body temperature. If you become too hot during the first weeks of pregnancy, it can damage your baby. If you are going to use the hot tub or the sauna, limit your usage to 10 minutes at a time. Get approval from your doctor before you start exercising. But in general, you should exercise for at least 150 minutes per week. This can be in the form of low-impact workouts, such as swimming, yoga, or walking. You don't need to eat enough food for 2 people to meet the needs of your baby, but you should consume an additional 300 calories per day. You can get these from foods that are rich in nutrients. During the second trimester, you will notice that your feet will begin to swell. Some women state that their feet go up a full shoe size. Get yourself a pair of low-heeled, comfortable slip-ons in a bigger size. You will start to experience aches and pains as the baby grows. A massage will help melt away the pain, get you to relax and to feel better. Book an appointment with a therapist who specializes in pregnancy massage. Ask friends and family members for recommendations on a good pediatrician. Everyone has their own opinion, so make sure they share yours, especially in subjects related to immunization and breastfeeding. If you are in full-time employment, you will be entitled to maternity leave. Stop using chemicals for household cleaning. Many of them contain harmful ingredients such as hydrogen peroxide. Switch to vinegar and baking soda instead. For a more comfortable sleep, roll onto your side. Not only will you feel better, but it also improves blood flow to the baby. You will know if you are going into premature labor if you begin to experience contractions that happen every 10 minutes and increase in intensity. Call an ambulance or go to the hospital immediately. Get permission from your doctor first, but often swimming can be a great way to exercise during the 3rd trimester of pregnancy by helping to alleviate aches and pains. You should also know that your partner is not an innocent bystander. They should play a role during the birth. Discuss what you want them to do. Do you want them to be your cheerleader, your labor coach, or would you like them to leave the room? When it comes to baby clothes, hand-me-downs are fine. However, you should always buy a new crib because you want your baby to be as comfortable as possible. Get your partner involved in the pregnancy. When the baby kicks, place their hand on your stomach so they can feel it too. All mothers want a healthy baby. However, you never know what can happen, so it's best to be prepared. Get your iron from foods such as beans, spinach, chicken, beef, enriched rice, and whole grain cereals. You will need 27 milligrams of iron per day. If you get blurred vision, your head is constantly throbbing, or your body feels swollen, go to the doctor immediately because you might have preeclampsia. There are plenty of options when it comes to giving birth. You may want to do so at home, in a birthing center, or a hospital. There are also other alternative techniques, such as water birthing. If you enjoyed the video, please remember to like and subscribe. Until next time!